Hello, I'm Dr. Keith Heinzerling. I'm the director of the Treatment and Research in Psychedelics program at the Pacific Neuroscience Institute in Santa Monica. I'd like to tell you a little bit about our psychedelic-assisted treatment program. Psychedelic-assisted therapy is a new groundbreaking approach to treating mental health and substance use disorders. It involves administering a psychedelic drug under clinical supervision to a patient with the objective of triggering an altered state of consciousness for therapeutic purposes. This is being investigated in clinical trials to treat a variety of mental health and substance use disorders, including depression, anxiety, PTSD, end-of-life distress, and drug and alcohol problems. We're very interested and excited about this treatment approach because it's quite different from the standard approaches that are typically used to treat mental health or substance use disorders. The usual treatments often are targeting what really are the symptoms of the condition, whether it's depression, anxiety, insomnia, drug and alcohol use to modulate negative or painful emotions. Psychedelic-assisted therapy, in contrast, is attempting to get at the core underlying issues that are causing those symptoms. If you think about it, it's almost as if the underlying problem is down deep in the depths, and after it bubbles to the surface, when it comes up at the surface, it may manifest in one patient as depression, or as another in insomnia, or another as alcohol problems. But what we're treating is really just those symptoms at the surface with your standard treatments. Psychedelic-assisted therapy attempts to go inward and deeper to get to the core issues, to pull back the curtain, so to speak, and get access to deeper parts of the mind or subconscious where we think possibly the root cause of these symptoms and conditions resides. In effect, the principle of psychedelic-assisted therapy is that each of us inside us has the capacity to heal ourselves emotionally or psychologically, but often we don't have access to that inner healing capacity, or there are barriers that prevent us from accessing it, whether it's the symptoms and the condition, depression, or ruminating thoughts, or constant cravings or obsessions. And also some things just reside in a part of our mind or our brain that isn't easily accessible in our normal states. Psychedelic-assisted therapy is attempting to allow the patient a pathway, a journey where they can attempt to reconnect with that inner capacity to heal. And it's very interesting and exciting because it's a very patient-driven and patient-oriented approach. If you think about it from a medical perspective, if there's an injury or an insult to the body, say a broken bone, many of the originators in psychedelic-assisted therapy have used this analogy. A broken bone, patients seek treatment from a doctor, but the medical treatment doesn't actually fix or heal the bone. You create the right circumstances for the bone to heal itself. Now, there may be the need to set the bone or even surgery, but in the end, the healing is done by the body. And the goal of the treatment is to facilitate the proper conditions to allow the body's own innate healing processes to successfully occur. Current treatments for mental health and substance use disorders are usually more oriented towards addressing the symptoms: antidepressants, anti-anxiety medications, anti-craving medications. Psychedelic-assisted therapy, in an analogy to the body's ability to heal, attempts to harness the mind and the brain's ability to heal itself. This is done, facilitated by the psychedelic dosing experience, the experience that happens during the psychedelic dosing session. But it's not just taking a psychedelic drug at all. As a matter of fact, patients are always very interested to hear about and asking me about the different psychedelic drugs and how they may be used therapeutically and what the effects are. But in psychedelic-assisted therapy, the psychedelic drug is actually just one part of the treatment and is merely a catalyst something to accelerate or augment an overall behavioral and psychotherapy treatment program and process. Whatever is in the mind when the drug is taken, the drug will act as a catalyst. It will open the door to whatever's there. And early practitioners of this approach often say that sometimes the patient and the clinician may not even be aware of what the main issue is. But if you trust the drug and trust the process, the medicine will show you the way. Psychedelic-assisted therapy involves a series of medical visits and counseling sessions before a psychedelic drug is administered. The purpose of these are to make sure that the patient is healthy and that it would be safe for the patient to have the medication administered. And the other purpose is to prepare the patient for the psychedelic experience, their subsequent treatment program and plan, and in effect the journey that they will take. The objective of psychedelic-assisted therapy, in many cases, goes beyond merely reducing symptoms, but of course that is a goal. People who are depressed or anxious, we hope that they will feel less depression and anxiety. People who are using drugs and alcohol, they will use less, or even better, stop using drugs or alcohol in a harmful way completely. But it's also possible that this may be a pathway for a personal transformation, whereby the patient is on a path to change themselves and their life to be more like what they would like it to be, a healthier, happier existence. The initial preparatory counseling sessions have several goals, but two of the most important ones are to set an intention for the psychedelic drug experience and the subsequent treatment program, and to prepare the patient to be able to let go as best as possible during the drug session, which will facilitate, we hope, the maximal therapeutic effect. Setting intention is somewhat like setting a goal for therapy. It might be a question that the person wants to answer, or a problem that they struggled with that they'd like to gain new insight into. Having an intention going into the drug experience is very helpful, because there are three factors, generally speaking, that influence the subjective drug experience. One is the drug, also the set and the setting. The drug is obvious. One drug may have a different effect than the others, and the dose. But the drug is not the only thing. Equally important is the set and the setting. Psychedelic-assisted therapy involves administering the drug and having the drug experience in a clinic under medical supervision. I'm here talking to you today in one of our rooms that is equipped for the psychedelic dosing session here at the Treatment and Research in Psychedelics program. We call it one of our trip rooms. As you can see, there's a couch behind me where the patient will recline. We give the patient eye shades and we play relaxing music in the background. And the patient is attended to by clinicians, and if necessary, their vital signs are monitored throughout the session. In addition to their physical and medical safety, a clinician is with them during the entire drug experience. And that's very important because research has shown that the most important predictor that we know of at the moment of a therapeutic effect from the psychedelic experience is the intensity of the experience. Interestingly, though, the experience need not be fully positive. Even a negative or challenging or difficult experience, something where maybe difficult emotions or past memories come up during the drug session, or the patient may have a frightening experience or be fearful or even think that they might be dying. Those experiences can be very cathartic and, in the long run, therapeutic. That could also be very terrifying if you were alone, so a clinician is at the patient's side during the entire drug session in case they do experience challenging or frightening emotions. Also, having a positive intention going into the drug session is very helpful because, as we said, set and setting are important. The setting being a safe physical environment that's nurturing and calming, and the set being their mindset or their frame of mind. So having a positive, healthy goal in mind at the beginning of the drug journey can be helpful. To have something to come back to during the session and afterwards, particularly if something negative or challenging comes up during the session. Following the psychedelic dosing session, at the conclusion, we ask patients to begin to journal, write down their thoughts. That's the beginning of the integration process, which will unfold over time after the dosing session with the assistance of a series of medical visits and counseling sessions with a clinician. Patients often have new insights or a new frame of reference that may emerge, or a new approach to the problem may come up. They may realize or have an epiphany even during the psychedelic experience. In order to try to make a sustained change for the better, the integration counseling sessions are designed to work with the patient to take something practical from the experience and apply it to change their day-to-day life, to make their life better. One thing that's very different about psychedelic-assisted therapy compared to standard treatment with antidepressants or other medications for mental health or substance use issues is that in psychedelic-assisted therapy, we anticipate administering the drug treatment maybe only once, or certainly a limited number of times, with a series of preparatory counseling sessions prior to the drug session, and then a period of time after the drug session, with several subsequent integration counseling sessions, which is designed to try to maximize and sustain the effects, the positive therapeutic effects of the drug treatment. So it really is an integrated approach where it's not just the drug, it's not just the counseling or the therapy. The two of them are interacting in a way that hopefully will result in much more long-standing results, particularly if the patient has a transformative experience or a new insight that allows them to make a qualitative instead of merely a quantitative change in their life or their condition. A variety of medications are available to use within this psychedelic-assisted therapy structure. One of the medications that we're using is ketamine. This is a treatment program that uses ketamine in an off-label capacity, which means that ketamine is not FDA approved for this purpose, but research studies have suggested that it can be done safely and may be helpful. And therefore, it's possible for doctors and patients to use a clinically available medication for other indications or conditions. Ketamine is approved as an anesthetic and is used during surgery at very high doses. Research has also found it to be helpful as a rapidly acting antidepressant. And the doses used to treat depression are much lower. They do not cause anesthesia. You may be familiar with ketamine treatment for depression. Many clinics have begun offering ketamine intravenous infusions to treat conditions like depression or chronic pain. The model that we're using, where ketamine is used within the context of a psychedelic-assisted psychotherapy program and is integrated and interacting with the psychotherapy, is quite different than the model used by these ketamine treatment programs. This is not to say that one model is better than the other. And some patients may do better with a strictly medical approach, and other patients may do better with the psychedelic-assisted therapy approach. But a ketamine infusion typically is provided to the patient without any associated counseling, and in many cases, the potential psychedelic effects of ketamine are considered a side effect. And in fact, many doctors and pharmaceutical companies have been working to try to figure out how to remove the potential psychedelic effects from the ketamine therapy. We, in turn, think that, in contrast, the psychedelic effects of ketamine may actually be how it works for depression, anxiety, drug or alcohol problems. So we hope to use the psychedelic-assisted model with ketamine as the psychedelic drug as a way to harness the potential effects of ketamine and extend and lengthen the therapeutic response. Because a major challenge with ketamine treatment, for example for depression, is that although patients may have a robust and quickly acting antidepressant effect from a ketamine infusion, without any other subsequent treatment, that effect usually wears off in a matter of weeks. In turn, doctors have investigated giving additional ketamine infusions. But we'd like to avoid that. Ketamine is a controlled substance. There is a potential for addiction and abuse. There are potential medical consequences of chronic ketamine administration. Again, there may be patients who benefit from this, and there are clinicians who may be able to provide that strictly medical treatment safely. But it is different than the model that we're interested in. In that case, it's the medication being provided in isolation, and the effect is riding on the medical or pharmacologic effects of ketamine. Here, it is the counseling, the psychotherapy, the process that the patient is engaging in. And the psychedelic experience is used to accelerate and augment that process, to allow patients to make much more progress than they would if they were approaching the problem using standard psychotherapeutic approaches, where patients often begin to deal with difficult emotions, challenging issues within a counseling session. It may become upsetting or overwhelming. And then typically, the approach would be to move away from that difficult emotion and then come back to it in a subsequent session. As a result, it may require many sessions over a long period of time to make progress. The psychedelic assisted therapy approach is different in that in the psychedelic drug session, if challenging or difficult things come up, we encourage the patient to go towards that, to explore it, to investigate it with us at their side. And it appears that the drug effect provides a loosening of their inhibitions such that with the support of the clinician during the session, they may be able to approach, even address, and move beyond some of these challenges or blocks to become unstuck, which is often how patients describe themselves when they come to us seeking treatment after having tried existing first-line therapies and not had a total response. Again, as ketamine is an FDA-approved medication and clinically available, FDA-approved as an anesthetic, it is possible to use ketamine off-label within psychedelic-assisted therapy to treat a variety of mental health or substance use disorders, including depression, anxiety, PTSD, end-of-life distress, drug or alcohol problems. Ketamine is not currently approved for those indications, with the exception of a ketamine nasal spray called esketamine, which is approved to treat treatment-resistant depression. The mode of ketamine therapy that we are primarily using during psychedelic-assisted therapy with ketamine is an intramuscular injection of ketamine. And we prefer this at the moment because that may be the mode that's most likely to produce a psychedelic therapeutic effect. In addition, there are other ways of administering ketamine, including orally or under the tongue sublingually, or an intravenous infusion, or again as a nasal spray. While we're working hard, setting up as many clinical trial options with psilocybin and then hopefully potentially other future psychedelic medications, it is possible for select patients, if appropriate, to obtain treatment for mental health or substance use disorders at the TRIP program in Santa Monica using ketamine in an off-label role as the psychedelic drug in psychedelic-assisted therapy. We currently have openings to see patients to be evaluated for possible treatment with psychedelic-assisted therapy using ketamine. Patients who have depression, anxiety, PTSD, end-of-life existential distress, grief or bereavement, drug or alcohol problems could be candidates for off-label treatment with ketamine in our psychedelic-assisted therapy program. Patients are very reasonably concerned and often ask, will insurance cover psychedelic-assisted therapy? Because psychedelic-assisted therapy is not currently an approved method, and the medications are not FDA approved, typically insurance will not cover psychedelic-assisted therapy, and it may cost the patient out of pocket for the treatment. Some of the care given related to psychedelic-assisted therapy, including doctor's visits or standard counseling sessions, may be billable to insurance and are a very important part of the overall treatment plan. It depends on your insurance, and as always, we recommend you check with your insurance company to find out about coverage. While ketamine is available to treat patients in an off-label capacity within a psychedelic-assisted therapy framework, other psychedelic drugs are only available at the moment within clinical trials. But clinical trials are underway, and many are exploring the use of other psychedelic drugs to treat depression, anxiety, drug and alcohol problems. For example, psilocybin, which is the active ingredient in magic mushrooms, is currently in clinical trials for depression. MDMA, which in its street form is known as ecstasy, is being used in a psychedelic-assisted therapy model to treat PTSD. Neither of these are approved yet, but research is progressing and shows promise. At the Treatment and Research in Psychedelics program, or TRIP program at Pacific Neuroscience Institute, we are working very hard to launch clinical trials of psychedelic-assisted therapy using psilocybin as the psychedelic drug. A frequent question is, how does psychedelic-assisted therapy differ from microdosing of psychedelics? Microdosing involves taking a small dose of a psychedelic drug intermittently on an ongoing basis, every 3 days, every 5 days, once a week. This practice is purported to have beneficial effects for mood, cognition, memory, although to date, very few well-controlled clinical studies have actually evaluated the safety and effectiveness of microdosing for any of these reasons. These psychedelic drugs are illegal and do have some safety concerns, and as a doctor, of course, we recognize, and in particular, as a doctor who is also a specialist in addiction medicine, we recognize that people may decide to take drugs outside of under a doctor's supervision. But as a physician, we can never recommend that. We can never recommend that you take medications except under a doctor's supervision. And that's why we're working so hard to try to set up the means for patients to obtain treatment in a safe, effective, and legal fashion at a clinic, at our clinic in Santa Monica, the TRIP Clinic, under medical supervision. Psychedelic-assisted therapy also typically differs from microdosing in that patients who are microdosing are taking a low dose of the medicine chronically over time, which is not that different than taking an antidepressant or other chronic medication in a way, with the exception being that microdosing is not approved or legal. In contrast, psychedelic-assisted therapy uses a larger dose of the medication aimed to trigger a full psychedelic effect, whereas microdosing is aimed to have a lower dose of the medication that does not produce the full psychedelic effect. Psychedelic-assisted therapy involves one or maybe a few drug treatment sessions over several months, with counseling and treatment sessions interspersed in between, and in effect attempts to limit the total number of times that you need to take the medication. For more information, you can see our website or call the clinic to schedule a consultation. Well, I hope I've been able to give you some information that's helpful and to explain what's available for patients in terms of psychedelic-assisted therapy here at the Treatment and Research in Psychedelics, or TRIP program, at Pacific Neuroscience Institute in Santa Monica, and also hopefully describe some of the future research that we're working on. Thank you for listening.